Hi everyone, today I'm filming a video discussing why the controversy around pandas and PANS is incredibly dangerous. So pandas and PANS causes horrific symptoms that can be absolutely debilitating and leave someone with a very limited quality of life, and life can even become a living hell because people lose their independence and are living with like horrible symptoms. And symptoms can include severe OCD, tics, anxiety, depression, motor coordination issues, brain fog, increase in urinary frequency, hallucinations, and much more, because it's different for everyone. But for some people, the psychiatric symptoms can become so severe that people become incredibly depressed or anxious, and some people even struggle with suicidal tendencies because of this. And there have been kids who said that they want to die because of this condition. But if anything at all can relieve these people's pain and suffering, then why isn't it done? It's no coincidence that these people go into remission once the infection is treated with antibiotics and once their inflammation is reduced through methods such as anti-inflammatories, and some people have something which is IVIG as well. It's no coincidence that people go into remission with these treatments because the root needs to be addressed. Treatment for psychiatric conditions is not always effective, but can manage some of the symptoms, because medications for pandas and PANS can sometimes make things worse, but for some people they do work, but it has to go on a start low, go slow method. And therapies such as CBT, ERP and CBIT can be beneficial for some people, but again, it doesn't get to the root, therefore the immune system is still attacking the brain, causing damage to the basal ganglia, and that can actually cause cognitive decline, because if it's not treated it can become chronically debilitating. And the therapies also doesn't cure it. So even though it can help manage the OCD, anxiety and tics and stuff, it's still there, and if you get to the root, it's more likely that a person can have the best quality of life that they deserve and reach their full potential. And therapies also don't reduce or address the other symptoms such as motor coordination issues, hallucinations, bizarre sensations and sleep issues. A lot of people with pandas can have sleep issues such as REM behaviour disorder, insomnia, night terrors and other things. So, you know, it can help manage, but again, it doesn't get to the root, therefore it's not getting to the other symptoms, which can also be debilitating. And some people can't even participate in the therapies because pandas can cause a near catatonic state, and for some people they have such severe brain fog, and some people even go non-verbal, and that can make participating in therapy incredibly difficult. Because I know for me, I couldn't really comprehend anything, and it was like I wasn't really there because of the brain fog, and I couldn't process anything, and I lost the ability to really think myself, and my memory was all fuzzy, so there was cognitive decline there, and that can make participating in therapies very difficult. But psychological therapies are said to be used in conjunction with the methods to reduce inflammation and kill the infection to help people manage, but it's not necessarily enough on its own. Early intervention is also vital, but people spend sometimes years trying to get an accurate diagnosis because so many people don't believe that pandas is a real thing, and that's just horrible. Like, pandas and PANS are real things. When I was 10 years old, my parents brought pandas up to the GP, and they just told us that you shouldn't believe everything you read online. But if these parents and carers and people will do anything they can to help their child, and early intervention is vital to prevent flares from being so severe and to give people the quality of life they deserve as soon as possible, because nobody deserves to endure that for a long time, and it can be horrific. And if it isn't treated soon enough, then I think you're more likely to have other flares later on. Pandas and PANS also has a massive impact on the family. So caregiver burden is quite high in pandas and PANS families. There was a study by Jennifer Frankovich that found that 50% of parents in their child's first flare exceeded the caregiver burden, but that reduced once a group of children were receiving treatment at a specialist PANS clinic. So treatment is vital, not just for the individual, but for their family. And some parents of people with pandas and PANS also have PTSD, which is post-traumatic stress disorder, because they live in fear of another flare. And seeing your child go through something so debilitating can be traumatizing, and caring for your child 24/7 and seeing their rage attacks, it can be horrible for families. And these parents need compassion, understanding, and support rather than judgment, because so many people think that pandas is a weird thing, and parents become frustrated because they're not listened to, and they just want what's best for their child, because that is what they need, the accurate diagnosis. And there have been kids in the USA who have been taken away by the state and parents taken to court because, you know, the diagnosis of pandas and pans is controversial, but it is real. And pandas and pans also leads to financial issues. Because it's controversial, insurance in countries such as the USA don't always cover treatment. That means that parents and carers and families are having to pay out of pocket to get their child back, because they would do anything because it's so horrific. And if it wasn't controversial, then the families wouldn't have these financial issues, because it could be covered easily by insurance and stuff. There is also an aspect of parent blaming. I've seen a lot of parents being blamed for their child's symptoms, but it's actually an inflammatory brain condition, and when your brain's inflamed, the individual, child or adult, has no control over their thinking, like rational thinking, behaviour or emotions, so it can make things very difficult, and it's not the parents' fault, and these parents just need understanding. Pandas and pans also has a massive educational impact, because the symptoms such as decline in handwriting and maths ability, ADHD-like symptoms, cognitive decline, brain fog, anxiety, OCD, constant intrusive thoughts can make education very, very difficult. And these people deserve to reach their full potential, and they deserve to have these symptoms remedied so that they can do maths, so that they can have legible handwriting, so that they can focus, because it can make things very difficult, and anything that can help is worth doing, which means treating the condition. Pandas and pans can also cause long-term or repeated school absences because of the severity of symptoms. These kids or adolescents might not be able to attend school, and schools need to have an understanding of why this is, so that the parents don't get in trouble for their kids not going in. And schools also need to understand how dangerous it can be for this individual to get an infection, so that they can report any instances of strep in the classroom or in the school, and so that they can address this accordingly, and so that they can make sure it's a safe environment for everyone to be in. But schools, because pandas and pans isn't necessarily understood, schools might not even understand it either. Thankfully, there are organisations such as Pandas UK that can, provide information on pandas and pans. But when pandas becomes more well known, schools will understand why, 1 minute a child seems like severely disabled by symptoms, and then when in remission they are fine, because it goes and comes with infections and stuff. Adults can also have pandas and pans, because if it's not treated in childhood, then it can become chronically debilitating, and these people actually, might live their lives with debilitating issues because they don't know what's causing it, they don't know how to address it. And people don't deserve to live their life with these issues if it can be treated early on. And there are people probably requiring lifelong support who have pandas and pans and don't know it, and there's probably many, many people in psychiatric wards and psychiatric units who have pandas and pans and don't know about it. There's also people can also develop pans in adulthood as well, and that needs to be understood just as much. This leads me on to the question, why is pandas and pans seen as controversial? Pandas and pans is seen as controversial because pandas is relatively new. It was first discovered by Dr. Suzanne Swedo in around the 1990s, and anything that's new is going to seem quite strange. If you look back to the Victorian era, the idea that germs and bacteria could cause illness and infections seemed very, very bizarre because they didn't believe it back then. It's sort of the same sort of thing now. We're learning new things, and it creates some sort of cognitive dissonance because it seems quite unorthodox, seeing how we tend to treat the mind and body separately. But it's actually a massive paradigm shift, because it can actually help treat many other conditions, because inflammation has a role to play in many other conditions as well, neuroinflammation, so it can actually help find treatments for other conditions too. It was originally just a theory, so that's why some people are still, I guess, trying to disprove the theory, but now it is more than a theory, because we can see that the diagnosis is given, and it's no coincidence that people go into remission when the infection is got rid of and when the inflammation is reduced. And it's also no coincidence that symptoms relapse and remit with infections. There is no coincidence in that. When somebody has strep or another infection, they have symptoms. The diagnostic and treatment guidelines for PANDAS were set out by the Immune Behavioural Healthcare team at Stanford, and I can link a video in the description down below by the people at Stanford that describes PANDAS really well and how it's often misdiagnosed as other conditions but needs to be addressed and identified. More research is desperately needed so that the awareness of PANDAS and PANS can get out to the public so that people can identify the symptoms, and to doctors such as psychiatrists, psychologists, neurologists and paediatricians, because these are the specialists that should know about PANDAS and PANS, but unfortunately some don't. So there needs to be more research so that the awareness is out there and so that there's better treatments, because it's already proven, it's no longer just a theory. Now we need to go the next step and get the awareness out there so that suffering can be reduced, because there's so many people out there with a variety of symptoms, not knowing what condition they have, or misdiagnosed as having OCD, ADHD, Tourette's, bipolar, ODD, SBD, a variety of conditions that probably are actually PANDAS and PANS if it's looked into. Thank you for watching. Bye!